The thing is, though, that the United States has never believed that. We've never believed that everyone is deserving of healthcare. Our healthcare system was specifically designed to exclude people, largely because of racism, because white Americans and politicians did not believe that Black Americans should have access to the same resources as them. And those beliefs have been reinforced over decades of policy decisions that prioritize some lives over others. Many medical facilities and hospitals were still racially segregated until 1964. Both of my parents were alive. When FDR introduced the New Deal after the Great Depression, when he realized, we need some sort of social safety net program for people, which included Social Security and unemployment insurance, he very strategically left healthcare out. Largely because Southern Democrats at the time opposed any system that would require racial integration or weaken their control over local systems that enforced Jim Crow segregation. Then after World War II, when countries like the UK and Canada and Sweden were building universal healthcare systems, the United States went in the opposite direction. We built an employer-based system where healthcare was tied to your job, but the jobs that offered healthcare were largely held by middle to upper class white men. And the people who were systematically excluded from those jobs because of racism were left out entirely. So we built a healthcare system based on unequal access. And in the 1960s, we decided a couple more specific groups were deserving of care, including some low-income Americans and older people over age 65, and we passed Medicare and Medicaid. In order to get Medicaid passed, Southern lawmakers required that it be state-run in order to maintain local control and continue their racially discriminatory practices that defined Jim Crow-era healthcare. Because many white Americans still didn't believe that Black Americans were deserving of the same care. That was the Civil Rights era, and the backlash to that era was strong. Politicians who wanted to appeal to white voters, mostly in the South and the suburbs, started using racially coded language like welfare queens in order to attack public support systems. Ronald Reagan, who launched his political career in the 1960s saying that Medicare would lead to socialism, became president on a platform of smaller government and personal responsibility. As president, he cut public health funding, deregulated hospitals, and paved the way for healthcare to become big business. Healthcare profits exploded and disparities deepened. While the language has changed, every time there's been an attempt to expand healthcare coverage since, it's been met with the same racial resentment, corporate lobbying, and a belief by the American people that not everyone is deserving of care. We're seeing it again today with the big beautiful bill that just passed, which include the largest cuts to healthcare in U.S. history, where an estimated 16 million people are expected to lose healthcare coverage. We're here today because we never built a system meant to care for everyone. We built one designed to exclude the people that we deemed less worthy of care. If we want a different system, we have to confront those values and choose differently.